Hello, I'm Gerard McClendon, and welcome to The Big Picture. The most important thing in your life besides your religious beliefs, family, friends, and your occupation is without a doubt health care. Eating right, exercising, and living a stress-limited life are a few ways to combat most maladies. Today we have a medical dynamic duo, the father and daughter team of Doctors David and Rebecca Ross, who will discuss remedies for back pain and consulting in the medical profession. Joining us in the first segment, my co-host, commentary, and biological brother, Teddy McClendon from the McClendonReport.com, and lead physician at Tatum Family Health Center in Gary, Indiana, Dr. David Ross, MD. Welcome to the show, sir.
Thank you.
Yes.
Thanks for having me.
Yes. Dr. Ross, we're going to start on a serious note. Of course, you're a physician, and you came up during the Jim Crow era. You know, you were in medical school at a time when things weren't that good for African Americans. Could you just briefly talk about the climate of what it was like in medical school and in undergrad in the 50s?
Well, in undergrad, I went to I shouldn't say predominantly, but an all-black college near Jackson, Mississippi, called Tougaloo College. And I say that because every time I say that, somebody says, "What? And where is that?" But it was a small college, and had about, that year, really had a lot of students because it had 300 and something students. It usually had 200 because that was the year the veterans came back. And at Tougaloo was a good place for growth. And I wasn't very talented, but there weren't many people there, so I could play football and basketball and be the president of the class and do all that kind of stuff, you know. So if I had gone to, say, Indiana University, I wouldn't have had that chance.
Right.
And I went to Tougaloo because when I got out of high school, the president of the school said, "Well, Ross, so you had a good record here," says, "What do you want to do?" I said, "Well, I want to go to MIT and be an electrical engineer." So he said, "Well, sit down." He said, "Now, we have not taught you anything at Piney Woods that will get you to MIT. He said, "So why don't you take a year, go to Tougaloo or Tuskegee or something, then after a couple of years, then you can transfer." And so I took that advice, and I went to Tougaloo because it's close to home. And Tuskegee offered me a scholarship to be a veterinarian, but I'm afraid of animals, so that wouldn't work out.
Didn't work.
So I went to Tougaloo, and Tougaloo was a good experience, as I said. And then after finishing there and thinking about what I'm going to do, when I went to Tougaloo, I went to be an electrical engineer. That was my interest. But by the last year in school, I'd gotten married, and there really wasn't nobody was out asking for black electrical engineers.
Right,
I mean,
right.
you know,
Wasn't in high demand there, sir?
So that if there was, it wasn't going to be for me. So I kind of learned that. But anyway, the state of Mississippi had decided they wanted to get more doctors in the rural area, and they would pay your way to medical school if you would say you were going back to Mississippi to practice. And so that's when I decided that I'd best change my profession.
Yes.
And it was a good thing.
Yes.
Because it's really been good.
And you chose Meharry Medical School. Why? Why did you make that decision?
I chose Meharry because I had two decisions to make, to either go to Meharry or Howard. And I had applied to both. Meharry accepted me first. So each time you got accepted, you had to pay $100. So I'd already spent my $100, so I went to Meharry.
Yes, sir.
That's about as simple as I could say it.
Yes, sir. Yes, sir. Choosing the medical profession, you know, I noticed looking at your resume, sir, that you didn't just stop there. You've done tons of research, and I'm going to kind of blow you up here because I love this resume. Bachelor's, Tougaloo, medical degree, Meharry. But I'm seeing leadership all through your resume. You're the medical director of several organizations. You've been a city court physician, director of First Mobile, president, CEO, primary care consultants. And the list goes on. And one that really hit me was, sir, you were the recipient of the Sagamore.
Yes.
Tell us about that.
Unfortunately, it had nothing to do with medicine. Or fortunately, I don't know. But when they started the casinos,
Yes.
Governor Back, somebody told him that I would make a good board member. And so I was one of the first board members that licensed the casinos here.
Yeah.
And we did such a good job that after, I think before he left, he gave us all Sagamore the Wabash.
Yeah, that's great. That's great. Now, quickly, what drove you, after you got into medical school? What really drove you to want to become a doctor? I know you mentioned the Mississippi experience, but what drove you to just stay in there despite some of the hard times you may have had in medical school? What kept you in there?
Well, I just never thought about, like anything that I would set out to do, I would just plan on doing it.
Yes.
And I've always, something new to me now is set goals and things like that. And I don't know whether I ever had any goals, but if I was in medical school, I mean, why would I not finish?
Right. But
see, I was just gonna keep going.
Now, see, Doctor, I've got to interrupt you here because, see, you make it seem as if accomplishing a goal is something that came naturally to you, and if I start something, I'm going to finish it. But so many others, and Ted, I'm going to have to ask you to come on in. So many other people use the opposite rhetoric. They start something, and it's too hard for them, and then they give up. And then they try something else, and it's too hard for them, and then they flounder. But your rhetoric, your bent is a little bit different here.
Right, especially in that time period. I mean, it's you make it seem like it's not that big of a deal, but I think it's a huge deal when you consider the time period and the landmines, if you will, of intolerance that pervaded the landscape. I mean, how did you navigate through that type of intolerance?
Well, as I look at the time, it didn't seem like a problem. Mm-hmm. And I'll be frank with that, because the first non-institutional living that I did was when I came to Gary, because in that little Piney Woods Country Life School, that was way out in the middle of nowhere, and that was it. Mm-hmm. So I really didn't get into any, any much racial stuff. I mean, that was about 3 white people who lived on that campus.
So you were sort of insulated then?
Yeah, so I was really insulated from all the stuff that really went on. So I think that what happens there is, your youth is a time of growth.
Yes.
And if nobody really gets in there and knocks you down, you continue to grow.
That's true. Right.
So as I said, at Tougaloo, I could grow, because I could be anything I wanted there.
And see, I love that term, growth. It's come up the last few shows.
Yes, it has.
And we see that in your family as well. Your wife and yourself raised wonderful children. Many of them have gone on to become physicians as well. And that's hyper parenting.
Absolutely.
Which is something we talked about in other shows.
Indeed.
You want to piggyback on that?
Well, we've got to bring him and his wife on for another show, you and your wife, sir, because we really want to expand on that whole parenting issue. We had a whole show based on that, based on early learning, early development, etc. But this show, maybe we'll keep it within the medical realm, and we'll go into that later. But certainly the viewers will remember that Dr. Rachel Ross was on very recently. Yes, this is Rachel Ross's father. And we're bringing on another Ross even after this. And this is a testament to the type of parenting that this gentleman and his wife have done over the years. It's just a landmark type of institution that is their family. And it's a wonderful thing. Yes. But maybe we can talk more about his clinic in Gary, the H. Theo Tatum Medical Center. And maybe we can start talking about that a little bit, Gerard.
Internal disc decompression. What is this?
Internal disc decompression is a machine that is designed to treat back problems. And of course, the ultimate back problem is a slipped or herniated disc, as you have probably known some friends who have had that, and some types of arthritis. So in the past, surgery was about the only treatment for that. or some very long rehabilitation type things that may or may not have worked out. And we found this machine to be the sort of ultimate in well, you don't have to cut into your body or anything.
Non-surgical. Evasive?
Treatment. Invasive.
Okay.
Thank you. Thank you very much. And invasive therapy for back problems.
Yes.
And it's a series of treatments that go on for about 6 weeks. And there's really about an 86 to 96% improvement.
Is that so?
Which is almost unheard of with those kind of problems.
So if my back is hurting, I can come to Tatum and get some relief here.
You can come to Tatum and get some relief.
Describe how that goes. What does a treatment consist of?
Well, a treatment consists of, first we do some heat to the back to sort of relax it and make the patient relax and make the muscles relax. And then the patient is put onto a fairly large machine, but the way it's designed, it looks pretty and it doesn't look foreboding.
Okay.
So the patient, if you've ever been to any kind of therapy, they have you climb on a table and you do that. But in this situation, you don't have to climb on a table. The table tilts to vertical, and you get on and get strapped in with harnesses in the hip area and harnesses here. So that what is done is a type of traction that is different in that the traction works on an angle that you set. It doesn't just pull straight out. Okay. And that's the secret of the machine, because as the angle over time, as it keeps pulling, it opens up that disc, and that's why it's called the disc decompression.
Right.
Opens up the disc space and increases the circulation in there, and there's healing.
Yes.
So that's actually what is done over that 6-week period of time, is to heal that bad back.
Yes.
So hence it's the compression that causes the pain, the compression of the
compression of the disc. The compression of the disc, where it pushes it out and makes it onto a nerve that causes it. That's what causes the pain. So the decompression sort of makes a negative pressure that kind of draws the disc back in or rehydrates it and gets rid of the pain.
I see.
You know, we're seeing how medicine is becoming more ergonomic now.
Right.
Indeed.
You know, this is a wonderful thing, and I'm really glad you're on the show today explaining this, because for years in medicine, if not for centuries, it's like, what's wrong? This is what's wrong. Okay, here's the remedy. But what you described earlier with the IDD therapy, you know, the table tilts as opposed to get on the table. And this is good that we're seeing medicine turn towards an ergonomic approach.
Yes, and I think the other thing that makes this kind of machine possible is, of course, the chips that makes it do exactly what you say. So you can put a protocol into the machine, and it does that until you change it. So you don't have to worry about the angles or anything. It's really a remarkable machine.
Excellent.
And I'm glad that we were kind of the first in the area to discover it.
Okay.
Well, where's that clinic located, by the way? You're the H.D.O. Tatum Clinic.
Well, the clinic is located directly north of Methodist Hospital, and actually it's on Methodist property.
Okay, well, that's that futuristic building that's on Fifth Avenue, is it?
That's correct. So it's right on Fifth Avenue and Grant Street. And you can tell it because it's the only building on that whole street, if you go 20 miles, that's built out of wood.
Indeed.
How about that?
And attractive wood at that.
If you want to get health care for internal disc decompression, you can always go to Dr. David Ross or any of his children who are all physicians at Tatum Health Center, and that is located in Gary, Indiana. We will be back. Hold tight on the big picture. We'll be back in a moment.
As chairman, I can say with assurance that our family is committed to remain independent. The deposits that we take in at our branches come back to the community in the forms of loans and other services that we provide. We are spending a lot of money and investing a lot of time into the training of not only our employees but our management, so that we can deliver the best service to our customers and make us the best bank in Northwest Indiana.
Mercantile Bank, solutions for your banking needs.
In the era of consolidation and big corporations, I think people appreciate being able to deal with people on a one-to-one basis. Mercantile offers that. We are spending a lot of money and investing a lot of time into the training of not only our employees but our management so that we can deliver the best service to our customers and make us the best bank in Northwest Indiana.
Mercantile Bank, solutions for your banking needs.